My name is Maria Roby, and today we will be talking about pancreatic cancer and everything that goes along with it, including symptoms, what causes it, and everything else. Throughout this lesson, we will be doing objectives. These objectives must be met in order to show that you have thoroughly understood the material that is being presented to you. There are three objectives that we will be covering today. The first is after watching a video on pancreatic cancer, the student will take the quiz with 100% accuracy. The second is after a PowerPoint lecture given from the instructor, the student will work in pairs to accurately list 5 symptoms of pancreatic cancer. And the final objective for today's lesson is, after a PowerPoint presentation, students will complete an exit slip listing 3 possible causes of pancreatic cancer. Now we will be moving on to our lesson. According to the first objective, we are going to be watching a video. I ask at this time that you stay quiet and don't do anything else but watch and pay attention to the video. You can take notes if you find that necessary. When the video is over, I will hand out a quiz for you to complete. You have until the end of the class period to finish filling out this quiz. It is an open note quiz, so you can use the following notes to help you complete it.
It's told what to do. It says you're part of the liver, you should develop into a liver cell, and this is what you should be doing. Similarly, in the pancreas, you're supposed to be a pancreas cell, this is what you do. But in a cancer, the cell develops a mind of its own and just starts to grow out of control, out of organization with the rest of the body. And because it really isn't influenced by the rest of the body, it just continues to grow. It doesn't do anything useful, and just simply through growing, bits breaking off and spreading and growing elsewhere, it replaces and consumes those organs that we need to survive.
The pancreas is an organ which lies at the back of the abdomen. It passes from here across to here. It's shaped a little like a fish with a head, body and a tail. It lies in the duodenum where it produces pancreatic juice. It has a beautiful orangey yellow colour to it, and it's soft, yet it is a very powerful organ because it makes enzymes which digest your food and also makes insulin to help you metabolize that food that you've digested.
Pancreatic cancer is usually a single tumour which originates in the pancreas but then can spread elsewhere. It can either spread to the lymph glands close to the pancreas, which we can still take out with an operation, or it can spread to the liver or the lining of the abdominal cavity called the peritoneum.
The important cancers of the pancreas are called adenocarcinomas, which means they come from the duct cells of the pancreas. And these cells arise in the ampulla or the opening of the pancreas, but mostly along the main duct of the pancreas. They tend to, for some reason, be able to grow more quickly and to migrate more quickly than most other cancers in the body.
We found 2 big tumors in my liver, which were the size of a tennis ball. And so we decided to do a biopsy after that. And after the biopsy, it was confirmed, yes, that I have endocrine carcinoids and that I have cancer, which started with the pancreas being the primary and metastasized to the liver.
So this mode of spread is called metastases, which means moving to a different site. And so individual cells of the tumour shed off and they lodge in other organs such as the liver, and then they continue to grow. And so whilst it is still pancreatic cancer, it now is in the liver. When we diagnose somebody with a pancreatic cancer, in order to decide what sort of treatment we're going to do, we have to do what's known as staging. to identify which stage the cancer is at. Is it as an early stage? Is it confined to the pancreas? Can we do things like surgery? Is it a little bit more advanced but still in the area of the pancreas, which means we can't do surgery, but we can use other things?
For patients who have a locally advanced non-resectable cancer, we usually give both chemotherapy but also give radiotherapy throughout the treatment.
Or has it already spread somewhere else like the liver, where neither surgery nor radiotherapy is really going to help, because just taking out the origin of the cancer isn't going to help because it's already spread. And so in that instance we use chemotherapy.
When Mum was first diagnosed, she told me that the doctor said she would only live for about 2 weeks, and and she was in absolute shock because she said, I didn't even feel sick. And then once they looked at further tests and scans and things, they were able to see that the tumour hadn't spread anywhere else. So they said they modified their prognosis to about a year. And as it turned out, Mum lived for 3.5 years, and she lived pretty well for most of it. She had a reasonable quality of life.
Generally with pancreatic cancer, it's got a bit too far by the time it's found. But they could have told me, yes, you can beat it. It is possible. It's not necessarily a death sentence. I was 50 and being told I'd be dead within 6 months. And I just wasn't prepared for that.
Actually, when I first told my boss that I had cancer, she really couldn't believe it. She said, you are one of the fittest person in the office. You know, all the other young men, they fall down like flies.
Unfortunately, the main risk for pancreatic cancer is bad luck. We don't really know enough about most of the cancers that develop. They just develop for a reason we don't understand. We do know that about 1/4 of pancreatic cancers probably develop as a result of smoking, and smoking is certainly a risk factor. Another risk factor is pancreatitis, or more specifically chronic pancreatitis, which is an ongoing inflammation of your pancreas. We know that diabetes is associated with pancreatic cancer, but it's not necessarily a risk factor. It may be something as a consequence of the pancreatic cancer or something that develops together. But unfortunately, the majority of pancreatic cancers don't occur as a result of direct risk factors.
For patients who have pancreatic cancer, you need to be aware there are lots of support services around, and that you should not feel isolated through this journey.
Now that the video is over, we will continue on with our lesson. Please continue to work on your quiz throughout this time. We will start by what is pancreatic cancer. Pancreatic cancer is a disease in which a malignant or cancerous cells form in the tissues of the pancreas. The pancreas is a gland located behind the stomach and in front of the spine, right below the sternum. The pancreas produces digestive juices and hormones that regulate blood sugar. Cells called exocrine pancreas cells produce the digestive juices, while cells called endocrine pancreas cells produce the hormones. The majority of the pancreatic cancers start with the exocrine cells. There are symptoms of pancreatic cancer, but unfortunately these symptoms can also be associated with many other diseases, which makes it so hard to detect. Symptoms include jaundice, oily stools, pain in the upper or middle abdomen or back, unexplained weight loss, loss of appetite, and fatigue. Depression is also associated. On the next slide, you will see a diagram found on the Pancreatic Cancer Action Network website. This is a list of all the symptoms that are really included with the disease and where they are located. I will leave the slide up so it will give you time to go through and look at the symptoms. Although they do not know the exact cause of pancreatic cancer, there are some precursors that could lead to it. Smoking, being overweight, excessive alcohol consumption, diabetes, frequent pancreatitis, or inherited immune disorders are known to be precursors for the disease. Once a doctor suspects pancreatic cancer, there are several tests that he can do. He may choose to do more than one. These tests include a CT scan, MRI, endoscopic ultrasound, laparoscopy, the prognosis for pancreatic cancer patients is not that hopeful. Help determine the American Cancer Society reports that only about 23% of patients with the cancer of the exocrine pancreas are still living 1 year after diagnosis. Only about 4 are still living 5 years after diagnosis. Pancreatic cancer has no early detection. Once it is caught, it is usually too late. It is the most underfunded deadly cancer. As far as treatment goes, there aren't very many options that will help cure the cancer completely. If the cancer is caught early enough, they can do a surgery to remove partial or your whole pancreas. Chemotherapy, radiation, and clinical trials are also chosen too by those who know that the prognosis is not good, but these can help minimize the symptoms that a person may face. At this point, I'm sure you're wondering what makes it so deadly. This is because pancreatic cancer tends to not be discovered until late in the course, and it's frequently has already spread to other organs, including the liver and kidneys and everything that you need to survive. Surgery can be performed to remove the tumor and the part of the pancreas, but this can only be done if there is no evidence of spread. Most people with pancreatic cancer are not candidates for the surgery. It's only about 20% of the time that they can have surgery. It really is the only chance for a cure for this kind of cancer. Even with the surgery, the cancer can recur, and it often does. Pancreatic cancer is not responsive to other treatments like chemotherapy or radiation. Chemotherapy has some benefit, but it's modest at best. At this point, you have learned all you need to know about pancreatic cancer in order to complete your assignments. Please turn in your quiz and go back to your seat. Take out a piece of paper and write your name on it. List 3 possible causes of pancreatic cancer and turn it in. This will be your exit slip. If you have any further questions, feel free to contact me about this disease. Thank you.